Good morning, friends. Welcome to our NG coaching or nursing updates. So, today we discuss about the important topic musculoskeletal disorder. In that topic is dislocations. So, we start from one good thoughts. Every sunrise is a second chance to shine. So, today's topic is dislocation. Dislocation. This is you see the picture dislocations. So, introduction of dislocation. Dislocation is a separation of both articulating surface of a joints. Articulating surface means the articulating surface is a smooth cartilage cover area in the end bone where forms a joint with the another bones. The next subluxations is a partial dislocation or incomplete displacement of the joint surface. Dislocation and subluxations is a disrupt a joint's by tearing the capsule and ligaments. A displaced bone may be difficulty for a bone blood supply, rupture blood vessel, damage nerve, and rupture the muscles attachments. So this is the articulating cartilage, this is the bone, this is the synovial membrane, this is the articulating capsule, joints containing synovial fluids, and this is the bone. This is all the joint. This is all the joints. Then type of dislocation. Type of dislocation. Dislocation may be in congenital, traumatic, or pathologic. First is congenital, second is traumatic, third is pathologic. So congenital dislocation are present by the birth, mainly seen in the hip and knee joints. Second one is the traumatic dislocation, a result from falls, blows, and rotational injuries. Third one is a pathologic dislocation, results from a disease of the joints, including infection, rheumatoid arthritis, paralysis, and neuromuscular disease. So in this picture, you see this is the congenital dislocation. So this is the traumatic dislocation, this is a traumatic dislocation, and this is the pathological dislocations. So next we will see cause and risk factor of a dislocation can occur in a contained contact sports such as footballs, hockeys, and in the sports may be involve falls such as downhill skiing and gymnastic and volleyball. A hard blow to joint during the motor vehicle accidents in another common cause dislocation. Dislocation is a landing on the outstretched arm during a fall. Then expressing a fall increase to possibility or dislocated joint. So causes and risk factor. What is risk factor? Contact in a sports. Then second is the um, involved in a falls such as and downhill skiing and gymnastic or volleyball. Then a hard blow in motor vehicle accidents and landing outstretched arm during a fall. Then expressing a fall increase the possibility to dislocate joints. Next, clinical manifestation of dislocation. Dislocation alter in the length affected to extremity. Affected to length in extremities, then pain is usually severe even upon the slightest of the movements. Then swelling. Swelling is also clinical manifestation. Significance is the hemorrhage to occur around the joints. Then numbness and tingling at the joints. Changes in a counter shape. Counter shape. Counter shape means shape of outer surface of the joints. Limited in the movement, loss of normal mobility. Change in the axis, dislocated bone. Deformity is usually present. Major complication, dislocated joints are open joints injury, intra-articular fractures, dislocation, and avascular necrosis, damage to adjacent neurovascular. So then next we will see diagnostic stage. In the diagnostic, both other damage to joints. X-ray and X-ray joints is used to confirm the dislocation and may be revealed or broken. MRI, magnetic resonance imaging (MRI) can be help a doctor to assess damaged soft tissue structure around the dislocated joints. The next we will see medical management. In that medical management, immobilize the joints. Immobilize the joint is affected joint to transport of the patient to the hospital. Doctor may be immobilize joints with this splint and slings for a several weeks. means a piece of wood or metal tie with the arm. How long split and sling is used to depend the joint involved in the extent of damage, nerves, blood vessels, and supporting tissue. Then second point, do not attempt to relocate it. Never attempt to relocate it, dislocation and position to repair the mandatory. Then subluxations must be also to examine by a physician. Bone ligaments damage is almost always associated with these injuries. The next, pre-RLCE management. Protect dislocated, sublocated joint spleen for the further injury. First is protects. Then second is rest the area to promote the healing. Then third is ice rigid. Ice means rigid, definite, indicated. Then where compression maybe elicites more pain, so this is have a to audit. Then next is if for elevation, this also may be difficult as it is would be required movement to accomplish. Then reduction, during this process doctor may be try to some gentle maneuvers to help the bones back into the position. Then bandage, splints cast extraction is used to maintain the joints and stable position after the reduction. Then fifth is medication. Most pain should be go away once the joint is reduced, returns to its proper place. However, a doctor may be prescribe a pain reliever or muscle relaxation to reduce the pain, or the counter medication such as ibuprofen, naproxen, and acetaminophen may be help to relieve the pain. The next, after reduction or immobilization, a gentle passive range of motion may be started, restore the strain that patients should be gradually return to the normal activities. Then last we will see nursing management. In the nursing management of subactions or a dislocation is directed toward the relief of the pain to provide the comfort protection of the injured or joints. Then second one, nurse should evaluate the neurovascular status of the patient by assessing a 5P in that pains, pulse, pallor, paralysis, or paresthesia. Paresthesia means abnormal skin sensations. The next one is the in that 5P assessments, first is the pain, pulse, pallor, paralysis, and paresthesia. Then third one is nurse should be teach the patient regarding the management of immobilization device. Then protection of the joints from the injuries and use to assistive adaptive device. The nurse should refer the patient to physicians and occupational therapies. So it is all about the dislocations. So thank yous, or please like, share and subscribe of your channel. Thank you.